Good afternoon, and thank you for the opportunity to present today. In this presentation, I will discuss a significant healthcare management issue related to patient identification and patient safety. I will introduce an original leadership model called the CARE leadership model, explain how it can be implemented within healthcare organization, identify key stakeholders, discuss strategies for obtaining organizational buy-in, and describe an evaluation plan for measuring both efficiency and effectiveness. Finally, I will explain the expected impact of the model on organizational processes, staff motivation, interpersonal relationships, communication, quality outcomes, financial performance, and change management. The purpose of this presentation is to demonstrate how effective leadership can address a complex healthcare management challenge. Patient identification errors remain a persistent patient safety concern across healthcare organizations, and reducing these errors requires more than policy changes. It requires leadership that promotes communication, accountability, teamwork, and continuous improvement. Today, I will explain how the CARE leadership model integrates several evidence-based leadership principles to create a practical framework for improving patient safety and organizational performance. The specific issue I have chosen is patient identification errors. These errors can occur during registration, specimen collection, medication administration, diagnostic testing, and care transitions. Even a seemingly small mistake, such as selecting the wrong patient in the electronic health record or labeling a specimen incorrectly, can lead to significant patient harm. Patient identification failures contribute to medication errors, delayed treatment, unnecessary procedures, and near-miss events. Because these errors affect patient safety, quality outcomes, and organizational liability, they represent an important leadership challenge that requires a coordinated organizational response. Patient identification errors have consequences that extend beyond individual patients. Financially, adverse events increase the cost of care through additional treatment, longer hospital stays, and potential legal expenses. From a performance perspective, these events negatively affect quality metrics and patient satisfaction scores that influence reimbursement and public reporting. Legally and ethically, healthcare organizations have a responsibility to provide safe, accurate care. Repeated identification errors can damage organizational reputation and reduce trust among patients, families, and staff. Effective leadership is essential because preventing these errors requires consistent processes, employee engagement, and a culture that prioritizes safety. To address this challenge, I developed the CARE leadership model. This is an original healthcare administrative leadership framework that combines communication, accountability, relationship building, and continuous evaluation. Communication focuses on clear expectations, standardized handoffs, and active listening. Accountability emphasizes ownership of outcomes and consistent adherence to safety practices. Relationships highlight collaboration, trust, and psychological safety among interdisciplinary teams. Evaluation and improvement ensures that leadership decisions are guided by data, feedback, and ongoing quality improvement. The model is designed specifically for healthcare environments where teamwork, safety, and continuous adaptation are critical for success. The CARE model integrates several established leadership theories. The communication component is influenced by transformational leadership, which inspires and aligns employees around a shared vision. Accountability reflects authentic leadership because it emphasizes transparency, integrity, and personal responsibility. The relationship component is grounded in servant leadership, which prioritizes supporting employees and fostering collaboration. Finally, evaluation and improvement draw from continuous quality improvement principles, including the plan, do, study, act cycle, and systems thinking. By combining these approaches, the CARE model provides a balanced framework for addressing both human factors and organizational performance. Successful implementation requires deliberate adoption strategies. First, executive sponsorship is essential because visible support from senior leadership signals that patient safety is an organizational priority. Second, leaders and staff should receive education and competency training related to communication standards, accountability expectations, and safety practices. Third, the CARE model should be integrated into policies, procedures, orientation programs, and performance evaluations so that it becomes part of everyday operations rather than a temporary initiative. Finally, performance dashboards and continuous monitoring should be used to track compliance, identify trends, and provide timely feedback to departments and teams. A wide range of stakeholders must be involved in adopting this model. Executive leaders provide strategic direction and resources. Department managers translate organizational priorities into daily operations. Physicians, advanced practice providers, nurses, medical assistants, and other frontline staff are responsible for carrying out patient identification processes. Quality improvement and patient safety teams provide expertise in measurement and analysis. Human resources and staff education departments support training and competency development. Information technologies help optimize health record workflow, while laboratory, pharmacy, and radiology departments are critical because identification errors frequently affect these areas. Patients and families are also important stakeholders because they are participants in verification processes and provide feedback about communication and safety. Obtaining stakeholder buy-in is often the most challenging aspect of organizational change. One effective strategy is shared decision-making, which allows stakeholders to participate in planning and problem-solving. Transparent communication is also essential. Leaders should clearly explain the reasons for the change, the expected benefits, and the data supporting the initiative. Education and coaching help employees develop confidence in the new processes and understand how the model supports patient safety. Finally, recognizing and celebrating early successes reinforces positive behaviors and demonstrates that leadership value employee contributions to quality improvement efforts. It is emphasized that leadership should be evaluated using both process and outcome measures. Process measures assess whether the desired leadership behaviors and operational practices are occurring consistently. Outcome measures evaluate whether those behaviors are producing meaningful improvements in organizational performance. In addition to quantitative metrics, leadership evaluations should include employee engagement feedback and assessments of communication, teamwork, and accountability. The evaluation process should be continuous so that leaders can identify opportunities for refinement and sustain long-term improvement. Efficiency measures help determine whether the model improves workflow performance without creating unnecessary burden. Compliance audit scores indicate whether staff are consistently following patient identification procedures. Measuring the time required to complete identification during admission helps ensure that safety processes remain practical and efficient. Tracking completion rates for care leadership and safety training demonstrate whether the organization is successfully preparing employees to implement the model. Improvements in these measures would suggest that the model is being integrated effectively into daily operations. Effectiveness measures evaluate whether the model is producing better patient and organizational outcomes. A reduction in patient identification errors is the most direct indicator of success. Safety culture survey results provide insight into whether employees perceive improvements in communication, teamwork, and leadership support for patient safety. CAHPS patient experience measures related to communication and confidence in care can help determine whether patients notice improvements in the accuracy and coordination of their care. Together, these measures provide a comprehensive assessment of the model's impact on patient safety and organizational culture. The CARE model is expected to influence several important organizational dimensions. Standardized workflows reduce variation and make safe practices easier to follow consistently. Clear expectations and supportive leadership can increase staff engagement and motivation because employees understand their role in patient safety efforts. Relationship-focused leadership strengthens interdisciplinary teamwork and encourages collaboration across departments. Improved handoff communication reduces the risk of information loss during care transitions, while increased psychological safety encourages employees to report concerns and participate actively in improvement efforts without fear of blame. This slide summarizes the broader organizational impact of the CARE model. From a quality perspective, fewer identification errors lead to safer patient care and better clinical outcomes. Performance improves through higher compliance rates, more efficient workflows, and increased patient satisfaction. Financially, preventing adverse events reduces costs associated with additional treatments, legal claims, and operational waste. Legal and ethical, the models support accurate documentation, regulatory compliance, transparency, and patient-centered care. Finally, by emphasizing communication, accountability, and continuous learning, the model strengthens organizational change management capabilities and helps create a sustainable culture of improvement. In conclusion, patient identification errors represent a significant healthcare management challenge that affects patient safety, quality, finances, and organizational trust. The care leadership model provides an original integrated framework that combines communication, accountability, relationship building, and continuous evaluation to address this challenge. Successful adoption requires executive support, stakeholder engagement, education, and ongoing performance monitoring. When implemented effectively, the model has the potential to improve patient outcomes, strengthen teamwork, enhance communication, support ethical and legal compliance, and create a culture of continuous improvement. Thank you for your time and consideration.